guys, welcome back to my channel. If you're new, hi, I'm Madison. I post college related videos, specifically all on nursing since I start nursing school in August. And today I'm going to be doing a video talking all about what I do in the day of a life of a PCNA, explaining and breaking down everything that I do, everything that I got trained on, what a typical day looks like. And yeah, this was pretty requested, and I think it's really good to get some insight if you're interested in this position, just so you kind of know what you are getting yourself into. And before I get started, I just wanted to say, you guys, thank you so much for subscribing. The last time I posted a video, we were almost at 3,000 subscribers, which is crazy. And now we are almost at 10,000. Like, what? You guys are so nice. And I love how you guys are all helping not only me in the comments, giving me like constructive criticism, giving me tips and advice, but also helping each other and being so supportive, because at the end of the day, we are all in this together. It is not a competition. We are all going to become, not all of us, but most of us are interested in nursing or in nursing school or thinking about it. And you know, it's not a competition. This is not, you know, we're just here to help each other and be the best people that we can be. And it means so much to me how kind you guys are, because it feels like you guys are all my friends, and it makes me really happy. And I just want that to be like, I want my channel to be somewhere where you can go and it's like positive and happy, because that's the stuff that I like to watch. And I want to give you guys tips so I can help you, and I want you guys to help me too, because obviously I'm going into this, I've never done this before, I'm not perfect, I don't even know what I'm doing half the time. So yes, with that being said, thank you guys so much from the bottom of my heart. It means so much to me. I've already teared up about it multiple times, so I'm not gonna cry, but thank you so much. You guys make my heart so happy. Okay, you guys, so let me just clarify, all hospitals are different, or the positions that you're gonna be working at, like all hospitals have different rules, protocols, and some PCNAs can do certain things while others can't, depending on like the state and stuff. So I will just put that out there now. It's obviously not going to be the same for every hospital, but this relatively is what you're going to be able to do. So first thing is my shifts are 12 hours and I work part-time. So that means you work 2 12-hour shifts a week. Full-time is 3 12-hour shifts a week. And if you are PRN, you have to work like a certain amount of days within like a certain period. So you're not like, okay, you have to work the 3 12-hour shifts a week, or you have to work the 2 12-hour shifts a week. You can kind of bounce around, which is really great for if you're in school, which I'm trying to switch to PRN once I get into school, but I don't know if they're going to do that for me, but that's a different story. So the first thing that I do, so I wake up at 5 a.m. because I have to drive to the hospital, which is kind of far from me, and I also have to catch a shuttle. So my shift goes from 6:30 a.m. to 7 p.m. and that 30 minutes before, because it's like a 12.5-hour shift, is for report, and they just switched this. So when the PCNAs are in report, the nurses are still on the floor if the patients need anything. And then the nurses have report from 7 a.m. to 7:30. So I'm already starting my shifts helping. I'm on the floor in case anybody needs anything, because none of the nurses are able to help because they're in report, if that makes sense. So that's why I'm in at 6:30. So prior to clocking in, I can't clock in until exactly like 6:30. I have a little notebook here, so that's why I'm like looking down. So I get like my Vocera, which is kind of like a little like phone walkie-talkie thing that you clip on you, and you can page other people in different rooms, like, I need your help, or can you meet me here, whatever. And so I get my Vocera and I log in and I put it on my badge, so I'm all ready to go for when I clock in. So at 6:30, I'm clocking in, and then I go to the little nurse station and I sit down with a PCNA who is on the night shift. And let me just say, I work days. So I sit down with the PCNA who was working nights, and she gives me a report on all the patients. So I have 12 patients, unless we're short staffed, then I will have more from like a different pod, because on like my wing of the floor, there's A pod, B pod, and C pod, and each pod has 12 patients. And each nurse gets 4 patients, and there's 3 nurses per pod. So 3 times 4 is 12, and there's 1 PCNA per pod. So I have 12 patients, and it is a lot. It may not seem like a lot, but it is a lot, especially if you have ones not who are like, I don't want to use the word needy, but who maybe aren't as independent and need a little bit more help. So it can get a little bit tricky and overwhelming, but it's great. And I'll tell you how much I love the job in a little bit. But so yes, for example, yesterday we were short staffed, so I had to split the pod with another coworker. So I had 12 on my pod, and then he had 12 on his pod. Then we had to split like B pod. So I had like 16 patients, but then they finally, throughout the day, they got another PCNA in, so I didn't have as much. But yes, so they give you a report and they kind of explain, they go through and they tell you about all the patients, why they're in here, you know, if they're on tele, and that is just if they're on heart monitors. And if they're on heart monitors, that means you have to check their vitals at 8 a.m., 12 p.m., and 4 p.m. And also if they're on AccuCheck, and that's when you're testing their blood sugar levels, if they're diabetic and whatnot. And you would also check that at around like 8, 12, and 4 right before they eat. So sometimes it's not always at that time if they're sleeping or if they haven't ordered their meal yet. You kind of have to be cautious or aware of when they're ordering, so you can come in like right before. And yeah, and that's, I'm kind of explaining stuff because I watched a lot of videos and people are like saying all this stuff and I'm like, I don't know what that means. So I'm just trying to like explain this. It might be like, you guys might be like, oh, I obviously know what tele is or AccuCheck, and that's fine, but I just want to make sure I'm explaining it if you don't know. So yeah, and I just kind of go on my like my charting thing and I print out like the list of everyone on my floor, and I'm taking notes while they're telling me this. And they're also going to tell me if the patient is independent, if they use a walker, if they're going to walk to the bathroom, or if they're on the bedside commode, if they use the bedpan. They just give me the whole rundown of the patient, if they've bathed them, anything like that, and then kind of notes like, oh, you should be aware that, you know, blah, blah, blah. And they'll let me know if they're on room air, and if they're not on room air, how many liters of oxygen that they're on. And also if they are ANO times 3, and that means alert and oriented times 3. So sometimes you're alert and oriented times 1 or alert and oriented times 2. It just depends. So yeah, and that can change throughout the day, so it's good to kind of keep track, so then you can tell the people this is what they've, you know, experienced throughout the day and stuff like that. So after you kind of do your 30-minute rounds, most of the time when I come in, patients are still kind of like sleeping because it is 7 a.m. Obviously, you're not going to get much sleep in the hospital, so some are awake. But while nurses give a report, what I like to do is kind of set up for my day. So I like to go and find the Dynamaps, I think it's Dynamaps, and that's like the vital machine. It's like on wheels. And I like to make sure that it's charged. So if it is, I like to make sure that I have one that's charged, because they just plug into the wall. And I'll plug in the other ones too, because sometimes people forget to plug them in, so they're not charged for the day, but I always make sure everything's charged for the night shift. And I also kind of clean it up, make sure I throw in some gauze, some alcohol wipes, and some, I don't even know what they would call them, like the little needle things to take AccuCheck. I'm not sure what that, there's a name, but I can't even think of it. I probably sound so dumb, so I'm sorry. But yeah, and then I'll get the little AccuCheck machine, put it in like the little bucket that I like kind of move around, and I make sure that I have everything in there so I'm set when I go into the patient's room. And we also have cabinets where we can get those supplies in the patient's room, but it's nice when you go in and you're prepared, you know what you have, and you can just do it and knock it out. So what I do is then after that, I kind of start doing rounds, and you have to round every hour on the patient, and that is you kind of see, okay, are they awake? Are they asleep? Are they sedated? Are they off the unit? So they could be, you know, getting CAT scans and MRI. They could be at surgery. They could be with their family going for like a walk. But we have to keep track of the patients at all time. It's an obvious reason. You have to know how, you know, what they're doing. And then like if they're in the bed, are they on their right side, the left side? If they're on their back, are they up to the chair? Anything like that. And you can also chart like toileting, and if they're in the room with patient companion, if they're in there with family, with workers, anything. So you do that every hour. So what I do is I also chart on the patients when I'm going to get their vitals, so I can kind of kill two birds with one stone in the morning at 8 a.m. So what I do when I go in is I make sure I know the patient's name, because a lot of people that I work with, like I'll mention the name and they're like, what room number, you know, because I know that a lot of people are busy and, you know, you kind of just know numbers, but these are people too. And I really, really try to get to know my patients, because Yeah, you have a lot to do. You have a lot to do. You don't get to sit down very much, but these are humans and they have feelings and they don't want to be treated just like something to kind of check off a list. They want to feel like, we're seeing them as a person and an individual. So I like to make sure I ask them questions about themselves and if they have a family or what they love to do, if they have pets. And I do get really close with my patients because that is something that is so special to me and so rewarding. So I like to get to know them for the day, and sometimes I have the same patients if I'm working a couple days in a row. Anyway, so you take the vitals, so you will check their blood pressure, their temperature, their pulse ox, and their, like on the thing, the little map will come up, the like mean arterial pressure and stuff like that. Are gonna order breakfast and they're on AccuCheck. I will test their blood sugar and I'll like chart that in the room because we have computers in the room as well. And while I'm in there, I'll ask if they want to order breakfast or if they need help. I'll call in for them and order. And I'll just see if they're comfortable, if they need to use the restroom. If I like to get them fresh water in the morning if they're not on NPO, and NPO means nothing by mouth. So normally if you're about to go to surgery or you've just got back or if you have like some tubes in, you can't eat or drink, but we do have like little mouth swabs where they can kind of wet it and just kind of moisten their mouth up a little bit because it does get really dry and painful for them. So yes, so I kind of make my rounds at 8 a.m., take vitals where it's needed, take AccuCheck where it's needed, and just make sure everybody's okay. So it's kind of a little bit hectic. So then the next thing that I have to do is at 12, and that's where at 12 you're going to check everybody's vitals, regardless if they're on heart monitors or not. And in between then, what I like to do is you're going to get a lot of calls. Patients are going to either want to bathe, they're going to want to go to the bathroom, walk a little bit. So it just depends every day. Obviously, new patients, something new when they have to go to the bathroom. So call lights will go on and I'll answer them. I will go to the room and assist them in what they need. And if the patients are in the restroom and they're okay, like sitting in there, what I like to do is I'll put on my gloves and I'll change their bedding out so they have nice, fresh, clean linens, because sometimes that doesn't always get done and you want them to feel as clean as possible, and sometimes they'll ask to put on a new gown even if they're not going to shower. So I do that. I like to kind of straighten up their room, and I'll just fill out who's like the nurse for the day, the doctor, I'll put my name as the PCNA, and also like fill out the date and stuff on their whiteboards just so they kind of know what's going on for the day and who is the staff on duty for them. And you can adjust patients and stuff like that. Like if they're in bed, help them turn. If they're like Q2 turns, which means they need to be turned every 2 hours just to help prevent like sores, pressure wounds, and stuff like that. Now I'm going to talk about what specifically I can do as a PCNA. And I should have said this in the beginning, but a PCNA is a patient care nurse assistant. And basically the same thing as a CNA, which is a certified nurse assistant. They're pretty much all the same. Different cities, different states, different hospitals have different terms, but you are really doing the same thing. So I got trained and like certified. So what you can do, so you have to be like checked off on like hand washing, super simple. But what I can do is I can take vitals, I can take AccuChecks, I can do AccuChecks, I can remove IVs, which I love removing IVs. I don't know why, I just love it so much. I can remove catheters, and I wanted to say that someone commented that you can't do that everywhere. It's like depends on the hospital. So at my hospital, I am allowed to remove catheters. I got trained to do it, but obviously it's gonna be different everywhere. So I can remove catheters. I got taught on like bathing and stuff. So you kind of do, I wouldn't even call it like the dirty work, because I mean, we're humans, like this is like natural stuff. Yeah, it's not like super glamorous, but the stuff that you're doing is such like an intimate moment with the patient, and you have to remember they're uncomfortable. Like they don't want another human being helping them clean up, especially if, they're older or if they're younger and they're in surgery or kind of like disabled. Like no one wants that. Like it's not, it's probably embarrassing for them. So it's so important. I always remind myself this, and you guys should too, that it's more uncomfortable for them than it is you. So try to make them feel comfortable. Yeah, there's gonna be bad smells, but don't make faces. Try to make them feel comfortable. Like I've had so many patients who apologize. I'm like, don't apologize. Like I'm here to help you and make you feel as comfortable as possible. And yeah, you're gonna have patients who aren't grateful, but you're gonna have some that are so grateful and appreciative of you, and that is so amazing that, you know, you get to help them through their times of need, and they're gonna remember you. They are gonna remember you. And I also wanted to touch on the nurses that I work with. I knew nurses did a lot, but these nurses that I work with are like freaking superheroes. They are amazing. They do so much. They're like we are just, even the patient care nurse assistants, we are like on hands constantly 24/7 with these patients. And obviously I'm not putting down doctors at all. Like doctors are geniuses, amazing, but they just aren't as hands-on with the patients because I'm sure they have a bunch of patients and they can't always be there, not even on the floor on like the unit. So I think they do like rounds in the morning. I see like the head doctor with like the med students, and you know, they kind of do report and then they kind of leave, but we're there with them 24/7, assisting them with everything to kind of make them feel more comfortable and help ease the pain and stuff. And I just wanted to share that I've had so many moments already where I've definitely teared up in the room with patients because they're just so amazing. And now I know to each their own, like with religion and like beliefs, and that's totally fine, but I do believe in God, and I've actually got to pray with a couple patients, and it's been just so not only like rewarding but kind of like life-changing. It just like makes me feel so grateful that I get to sit and just hold their hand. And I really like to get, if they're in the bed, I like to get down eye level with them because it's kind of intimidating when you're like standing up looking down at them. And I just sat and like get to hold their hands. And this one patient in particular said, you know, your smile and your kindness has been stronger than any medicine that they've given me. And that just reminded me that take the time to get to know your patient. Take the time to make them feel loved, make them feel like it's going to be okay, and just help them, you know, help them by kindness. Even as nurse assistants, we can't prescribe painkillers. We can't, you know, do a lot of stuff, but at the same time, you can, like, just being there to listen to them, being there, having like a heart, and just trying to understand what they're going through, even if you can't, because a lot of us can't, you know, but knowing that you're there for them is going to help them so much. And I go into the room every time with a huge smile on my face, like, how can I help you? What can I do to make this better for you? Or what can I do to make your stay better, or make you more comfortable, or help you, you know? And sometimes all they need is someone just to listen to them. And that's something that I think we need to remember. Don't treat your patients like things you need to check off the to-do list, because I know we have so much to do, and sometimes it's hard not to, but take the time to get to know them. Take the time. One time I spent my lunch break talking to a patient, you know. One time I stayed an hour after to talk to one of the patients who I had gotten close with and his family, and knowing how much I impacted their lives in a positive way and helped him, it was just like, I go home every day and it's like, I don't even feel like I just worked 12 and a half hours. You know, it's like, this is amazing. You get to, it's just such a rewarding job. It's not like I said, I wouldn't even say, oh, I do the dirty work of nursing, because you get to do so many amazing things as well. And it's like, just, I don't know. I learn every day. I am so open. Every day I go into work, I'm open to learning more. I've learned so much. I've become so much more confident and happier doing this, and that I get to go into work and I get to help people is insane. Like, not everybody gets to do that. So I am just so grateful for this position. I'm so grateful for everybody that I've met. And yeah, there are hard days, you know, and you're gonna have patients who don't like you for absolutely no reason, but then you're gonna see them treat everybody else like that and know that it's not you, it's just their personality, and maybe they're just going through a really hard time and that's not how they normally act. Nobody wants to be in the hospital. No one wants to, you know, get out of surgery and just feel like groggy and gross. So just be patient with them. You have to be patient and just show them that you're there for them and you're going to take care of them. So that was like such a little ramble, but yes. So I'm going to talk about like lunch. I get a 30-minute lunch, and I kind of like to take lunch around like 2-ish, but I didn't get to take lunch until like 4 yesterday because the day was so busy. And yes, so then after at 4, I'm going to do the same thing with AccuCheck and Tele. And then when stuff kind of slows down, which doesn't really happen. But if I have like a second of free time, I like to change out the dirty linen like baskets, and then I'll take them to like the chute and throw them down. And I just kind of like throughout the day, when you're not doing like your tele and Accu checks at like 8, 12, and 4, you are helping with baths, you're helping assist if they need to go to the restrooms, if they are assist feed, I get to sit and feed the patients and stuff. And it's a lot to do because I have 12 patients, and I'm sure other people too, you guys have a bunch of patients. And, you know, even though you want to give all your attention to like one person, it's like, okay, like let me set this time, okay, and I'm going to give you all my full undivided attention, okay, but then I'm going to go to the next patient, but I'm going to come back and check on you and ask how you're doing. And I remember names, I remember the stories that they tell me, and just be compassionate. That's all I want to say. I will empty their Foley bags. If they're full, I measure it. You have to chart how much they've urinated, or like you kind of have to chart if they had a bowel movement, kind of what it looks like, the size, the color, just so we know, so like the nurses, doctors know like their output, input, stuff like that. Okay, and I also wanted to say the reason that I decided to work as a PCNA was truly because I suffer from anxiety. I've been diagnosed with anxiety. I'm not just like using that term lightly. So I was really scared about starting nursing school and like clinical. I was like, oh my God, clinical, like, oh my gosh, oh my gosh. So I thought it would be a good idea to get a job like this, and it has helped so much. You learn so much, you guys. Oh, it's just amazing. And these nurses are great. Obviously not every nurse is, you know, going to be super nice, but I work with some amazing nurses who are so willing to help. I ask so many questions all the time, and they may think they're dumb questions, but I don't think any question's dumb. I'm trying to learn, and most of them are really understanding of that. I think, oh, I've learned so much today. It's like the next day I learned so much more, and it's like, this is so great just to be aware of, I'm gonna get to do this, and I've learned just so much, like terminology and everything, and it's so great. And I think this is really good if you want to figure out if you really want to do nursing or not. Obviously, you're going to be able to do more, and then some of this stuff you're not going to do as much once you're like a nurse. At 6:30, from 6:30 to 7 is when we do report for the night shift. So they come in and like you just give them the rundown of everything again on your patients. And before I leave, I like to say bye to the patients and stuff. And yeah, so that's what I do. Same thing, report goes the same in the morning as it does at night. And yeah, I just wanted to say too that I have met really amazing people from all different like specialties in the hospital. People who are like housekeeping, people who do like food and nutrition, so they come and deliver the food, transporters. And let me just say, you need to treat everybody the way you would want to be treated, no matter if you are like the top surgeon or if you are something else. I have met the sweetest women who are on housekeeping. I know their names, we're like friends. I help them pick up and stuff here and there if I can. And just remember, no matter how far you get up into like your career, or if you're just starting, remember to treat everybody the same. Like, I think there's like a quote, it's like, you know, treat the janitor just the same as you treat a CEO of a company. And that's so true. Like, your level of experience or education does not define who you are. Yeah, it's great to, you know, say, oh, I'm this. Like, my name has these letters behind it. But at the same time, it's like, we're all humans. We are all figuring it out, going through life, wanting to be happy. And it's just a really good reminder to treat everybody the same and be kind and generous. And I mean, I just wanted to put that out there. I know that's kind of random, but be kind to everybody. It is not hard to be kind, and you can make somebody's day. The world needs more positivity, okay? In hospitals, it needs more positivity. And a lot of people that I work with who are also nurse assistants are like, oh, like, you're so bubbly and happy, and that's gonna change. You're gonna get tired of working here. And I'm like, no, because this is my personality, regardless of if I'm here or not. And I've gone through hard times where I wish somebody was the light for me, and I want to be that light for everybody else. And this is who I am, and I'm not going to change. Yeah, I'm not going to have the best days every day. I'm not going to have the nicest patients all the time, but that's not going to change me. And yeah, this is who I am, and I'm gonna continue to give the best of myself to my patients. I know this was kind of a long video, kind of rambly, like talking wasn't really structured, but your days are not structured. You never know what's gonna come in, and you never know what the day's gonna hold, no matter what floor you are on in the hospital. So I hope this video was helpful for you guys, and I hope you kind of got an insight on what you were able to do as a nurse assistant. It's an amazing job. I love it. The 12-hour shifts, don't be intimidated by them. You're so busy. They go so fast. With that being said, that is the end of this video. I hope you guys found it helpful, and if you have any other video requests, please leave them down below. Give this video a thumbs up, and also subscribe. I have a lot more videos planned that I'm going to film very soon. And yeah, you guys, thank you so much for everything. You guys are amazing. You guys are like the sweetest people in the whole entire world. Remember, we are all in this together, and we are all trying to achieve the same goal, and we all need to stick together, support each other, and just be aware of the blessings that we all have in our lives and how we can use our experience, our blessings, and what we have to help others. So thank you guys so much for watching, and I love you all so much, and I will see you guys in my next video. Bye!